And MedGlobal is now increasing its presence in Lebanon to meet a growing need for medical care there. As Israel targets Hezbollah, airstrikes and ground raids are happening more often, leading to casualties and injuries. According to the nation's health ministry, Israeli airstrikes have killed more than 2,300 people since October 7th. Now, most of those deaths happened in the last month. The United Nations says 1.2 million have been forced out of their homes. So I want to bring in Dr. Ahmad, who, as you just heard, is now on the ground in Lebanon. I know you've been very busy, Doctor. Thanks so much for joining us. You just arrived last Tuesday. Can you tell us more about what you are seeing in Lebanon and what you and your team are doing to provide care there?
Yeah, I mean, what we're seeing is a mass displacement of people in the south. You just mentioned how the UN is saying it's more than 1.2 million people. Well, we're seeing those people on the streets in Beirut and in Sidon, where we are here. They're literally in the streets. There's not enough shelters to accommodate them. There's not enough aid entering into Lebanon to be able to work with many of these displaced people. In fact, it's about a fifth of what Lebanon needs to be able to make sure people have what they need just to survive. And we're hearing airstrikes. We're hearing the fighter jets. I mean, that's what we're hearing every single day here in Lebanon. It's developing into a truly catastrophic situation. And it's almost like it's deja vu when you think back to what's going on in Gaza and what's currently happening in the north of Gaza.
A big part of your work is training other healthcare professionals. So tell us about that. What exactly are you helping them with?
Yeah, I mean, it's exactly what you would expect. It's about these trauma scenarios that's being thrusted upon all of them. The healthcare system already was stretched so thin in Lebanon. And what we're noticing is that we want to be able to help build the capacity of local healthcare workers with respect to the trauma patients that they may receive. You know, when you have a 2,000-pound bomb dropped onto a 5, 6, 7-story building, you get a rush of patients to the emergency department. You get 30, 40. And it will overwhelm any hospital. The hospitals that I work at in Chicago, it would overwhelm us. And so what we're trying to do is be able to say, how do we navigate through these mass casualty events? What do we do to make sure that we can help the people who've been affected by these Israeli bombs? How can we make sure that they have a chance at surviving? And that's really what the training is focused on, in addition to trying to get more hospitals up and running to be able to accommodate the escalations that we're seeing.
You know, as we just heard you tell Megan Hickey, we know you were in Gaza earlier this year. Are there any differences? Did the work there prepare you for the crisis in Lebanon in any way?
Yeah, you know, I think Gaza is an absolute nightmare. It's hell on earth. The people are being starved by the Israeli military. The entire civilian infrastructure is being devastated. Its life in general is under attack, as I mentioned in that interview. I mean, any part of life, education, whether it's healthcare, even vaccinations, you know, polio, which was eradicated for 26 years in Gaza, came back because of the lack of water infrastructure. The Israelis literally bombed all of the water infrastructure. So what we're seeing here is the early signs of neighborhoods being leveled. And it doesn't matter what's in that neighborhood, a hospital, a mosque, a church, a family home, it's being leveled. And so we're seeing early signs of that. I truly hope that it doesn't get to that point. And everybody here in Lebanon will say the same thing. The United States is the only one that can stop this from happening. And so I truly hope that the political will and courage is there from the Biden administration to be able to stop what's happening here, so we don't see, you know, this humanitarian situation that was created by the Israelis devolve any further.
Okay, Dr. Ahmad, thank you so much for joining us. I know you're with MedGlobal again, and we appreciate your insight and your perspective from the ground in both Lebanon and Gaza. If you would like to help support MedGlobal and its work, you can donate online at medglobal.org. We'll be right back.